my biggest thing is that it's tied to so many people's jobs. So they will choose their career, their job based on what kind of healthcare they got, right? I mean, I literally know people who have
Yeah.
had the same job for
Yeah.
forever because of the healthcare that it gets them, not because of any other reason,
Healthcare should not be tied to your job.
right? I
That
mean,
was,
it's so
yeah, I
crazy.
mean, it's simple as that. That was an artifact of ERISA and the health insurance mechanism coming out of the 70s and some court cases. And since then, it's been tied to your job. And like you said, because of that, people are tied to jobs that they either don't want or they get underpaid. There are plenty of studies that say the cost of healthcare has made it so that it's depressed people's wages. And the reality
Yes.
is you can't have it both ways. And this is a conversation I had with people. This isn't, some crazy right wing talking point versus left wing talking point. This is math. And we're trying to figure out how we work on this. If we do not lower the cost of healthcare, it will eat up the cost of everything else. And we can get there. A good example is it costs so much money to throw someone, unfortunately, in a nursing home compared to getting care at home. If you pay a family member as a caregiver $25 an hour, which is a wage that would help them out in terms of economics,
Yeah.
they're safer to get their care at home than they would be if they were thrown in a nursing home that would cost astronomically more. And then they're
Oh,
at higher
wow.
risk of getting COVIDs and other types of things as well, right? And they're being taken care of by someone who loves them.
That's awesome. I never heard that before. That's such a great idea. Plus, they're with their family,
Yeah.
right? I mean, everything is a positive to that. There's literally no negative to that.
I mean, you don't have someone trying to decide between, am I going to work this particular job or am I going to take care of a loved one who needs me?
Absolutely, 100%. And that's a big problem here, and I'm Latin, man. Like my mom's Mexican, and part of the Latin community is you take care of your family up until the very end. They'll come live with you, right? That's essentially how it works. And
And that
yes,
disproportionately affects women.
sure.
And
Oh, of
it ends
course.
up being, yeah, a women's rights issue as well. During
Sure.
the COVID pandemic, we had a situation where a lot of people were pulled out of the workforce because you couldn't get childcare, right?
Yeah.
And a
Yeah.
disproportionate number of those people were women. So it's like when we're looking at these solutions, like how do we fix X, Y, and Z? Sometimes you just have to be practical and say, look, we can fix it by paying people a wage that they can raise a family on, making it so we move healthcare away from the most expensive aspects of healthcare, whether it's insurance, or whether it's in the hospital, whether it's, in a nursing home. We right size the healthcare system. We force enough competition within the insurance industry so you don't have, I'm sorry, I mean, you don't have insurance executives making double digit eight figures running a health insurance plan, and that being money that's being sucked away from actual care. I mean, that's just not the way the system's supposed to work.
No, absolutely. I mean, we should want Americans to be doing well. It only does better for America,
The
right?
entire country.
I mean, yeah, it's like we all benefit from it. It's like when people say, well, going back to, well, I don't want to pay for other people's health care. People will tell me that. I'll go, you know what? I don't have children, and I pay for your children's school. So get out of my face with that stuff. I say, and I have no problem investing in education because
That's the
those are
future.
Americans. These are the future, right? These are people going into society. I mean, I have zero problem with it. I don't even think twice about it. And
Yeah.
I feel the same. I feel the same way for healthcare.
Yeah. Do you not want to pay for the roads that get people to work each day?
I mean, absolutely.
Do you
There's
not
certain
want to pay
things.
to, yeah.
Yes.
Do you want to just, hey, let's just, smash all the bridges. We don't need them anymore because someone else is going to use them.
Yeah. Yeah.
How dare them?
Exactly. Exactly. Yeah. We all get our own private bridges, right? I mean, it'd be impossible.
Yeah, exactly. Well, I don't want any more buildings except my house because,
Yeah.
I don't want anyone else in houses. That's just ridiculous.
Exactly. Exactly, man. I'm blown away by that. And I've lived in places. I lived in Spain for a few years where they have, free healthcare and private healthcare. That's what I tell people. Oh, well, we're going to have the crappiest doctors and nobody's going to want to be in healthcare. I'm like, what are you talking about? Like that's completely like not true. You can still have like some public system, but also a private system for people that maybe have more money and want to do something else. Okay, no problem. Go do that. There's nobody stopping you, but everyone can go to the doctor. Everyone can go to the dentist. Everyone can go get glasses if you need them. You don't have to worry about, I work with so many people in the restaurant industry that wouldn't go get taken care of
Mhm.
because of no healthcare, man. I mean,
Yep. Well,
literally everyone I've ever worked with, to be frank with you, it's very rare to find a restaurant. It was usually corporate that would offer some sort of healthcare. And again, tying it back to, these businesses. And also, if you're a small business, you may not be able to afford healthcare for your employees. You
might
can only
not.
hire 5 employees.
Right.
It's like, and they're looking at you like, please give me healthcare. Otherwise, I'm going over here. And now we're fighting amongst each other when we're not the ones that should be battling against each other, you know?
Exactly. No, I totally agree.